And the thread that unites all of these problems is metabolism.
Metabolism. And at the end of the day, you have to talk about mitochondria in order to understand metabolism. Only 7% of US citizens have no signs of metabolic health problems, meaning 93% or so of US residents will have at least one of the biomarkers of metabolic syndrome, meaning they have prediabetes or abnormal lipids or high blood pressure or abdominal obesity or abdominal fat, excessive abdominal fat.
So what do we offer those 93%?
So those people, diet interventions would absolutely be a part of a healing strategy. A part of it, not the only strategy. I would want to know about their sleep. I would want to know about substance use. I would want to know about medications, lots of things. But for dietary interventions, I would want to meet them where they're at and just find out, well, where are you at? What are you eating? Do you have preferences or demands for what your diet should be?
Could you give me a case study then? Maybe a more extreme case study from your practice that you've seen.
I can give you the simple cases which probably apply to the majority of human beings on the planet. But if it's okay, I'd rather give you the extreme case, because a lot of people are skeptical. They probably hear me saying this and they think, well, you're just talking about general health and wellness. What about people with real mental illness? What about people like your mother whose lives were decimated by mental illness? This doesn't have anything to do with them. And what I'm here to say is, no, actually, this has everything to do with them too. But yes, it applies to just common everyday people. But, probably, so one story that I will just share because it's probably one of the most powerful stories I know. It was a woman whose real name was Doris. And in the book, I called her Mildred because I changed everybody's names. But she actually gave me permission to use her real name. So in honor of her, I want to use her real name. So she was a woman who actually had a horrible abusive childhood, lots of trauma. And by the time she turned 17, she started having daily hallucinations and delusions and was diagnosed with schizophrenia. Over the ensuing decades, she tried numerous antipsychotic, mood stabilizers, antidepressants, and other medicines, but none of them stopped her symptoms. She remained with all of the symptoms of schizophrenia. She ended up gaining a massive amount of weight. She ended up weighing about 330 pounds by the time she was 70. Her life was devastated by this diagnosis. She had a court-appointed guardian to manage her financial affairs and other affairs. She had professionals coming into her home to help her with paying bills and grocery shopping and stuff like that because she couldn't do it for herself, which is not at all unusual for people with schizophrenia. And between the ages of 68 and 70, she tried to kill herself at least 6 times and was hospitalized for those suicide attempts. She hated herself and she hated her life. When she was 70 years old, her doctor told her, "You're overweight and you need to go lose some weight." And she was referred to a weight loss clinic at Duke University where they just so happened to be using the ketogenic diet as a dietary as a weight loss tool. And for whatever reason, she decided to give it a try. And so she tries the ketogenic diet. And within 2 weeks, not only does she start losing weight, but she notices dramatic reduction in her hallucinations and delusions. Within months, all of her symptoms of schizophrenia were in full and complete remission. She starts tapering off her psychiatric meds, Within about 6 months, she was off all of her psychiatric meds, and her symptoms of schizophrenia remained in remission. Doris went on to live for another 15 years, symptom-free, medication-free, out of psychiatric hospitals, no more suicide attempts. She stopped seeing mental health professionals pretty quickly because they were kind of worthless in their mind. They hadn't really helped all that much. She lost 150 pounds and kept it off until the day she died. She ended up dying at the age of 85 of COVID pneumonia. And, but her story tells us, like, we could get, if you want, we don't have to, we could get into the science of the ketogenic diet and what it's doing to metabolism and mitochondria.
I'd love to know.
But there's an entire story that helps us understand what happened to her and how exactly that resulted in her really spectacular and almost miraculous recovery. So unbeknownst to most people know the ketogenic diet is a fad diet. And a lot of people are really worried about it. They've heard that it's dangerous. It'll give you a heart attack. You'll die. Unbeknownst to most people, the ketogenic diet was developed over 100 years ago now by a physician for one and only one purpose. It was developed to stop seizures. And in fact, the ketogenic diet has been studied extensively for its effects on the brain over the past 100 years. And it is an evidence-based treatment for epilepsy. And the reason that is so important is because we use epilepsy treatments in psychiatry all the time. Lots of the medications that we prescribe to psychiatric patients are, in fact, epilepsy treatments. And so we know that there's a lot of overlap between epilepsy and mental illness, and that treatments that help with epilepsy can also help with mental illness. And so we actually know more about the biology of the ketogenic diet and its effects on the brain than we do any other dietary intervention. It changes neurotransmitter systems. It decreases brain inflammation. It changes the gut microbiome in beneficial ways. It actually changes gene expression or epigenetics. But most important and relevant to my theory is it improves mitochondria and mitochondrial function. And if you do it long enough, over a long enough period of time, you can actually repair mitochondrial dysfunction in cells, at least for some people. And then you can actually stop the diet. So in the epilepsy world, when neurologists use this diet to stop seizures, it's usually not a lifetime treatment. They usually only need to do the diet for anywhere from 2 to 5 years. Many people, about a third of people who have treatment-resistant seizures will become seizure-free. And another third, so 2/3 total, another third will have a dramatic reduction in seizure frequency. So that leaves a third for whom it's not really working. But these are people with treatment-resistant epilepsy. And there's no treatment that's going to work for everybody because we need to look at all the other things involved. If, say, somebody has seizure cessation, they get rid of their seizures on a ketogenic diet, usually they have to do it for 2 to 5 years, somewhere in there. And their clinician will help them decide how long they should do it. And then they can stop the diet. And most often, the seizures don't come back. It seems to actually heal the brain.
What is that diet adding or subtracting from the body that's causing that pretty phenomenal effect? Do people know?
The real answer is we don't entirely understand. We don't know.
I mean, the ketogenic diet removes sugar, for example.
It does.
Pretty much entirely. I mean, I've been on that diet I was on the diet for about eight weeks or so just to try. And I couldn't have anything with sugar in it, pretty much.
No sugar, no carbohydrates, very few carbohydrates. So some people will argue, well, the diet is getting rid of gluten, and gluten is maybe the toxic thing. Other people will argue, oh, the diet is adding like some extra protein or meat, and maybe that's replacing a nutrient deficiency like vitamin B12 deficiency or something like that, or iron deficiency. And all of those things might be true for some people. I don't think those are the primary explanation. I mean, obviously, if somebody has vitamin B12 deficiency, replacing vitamin B12 is essential. If somebody has iron deficiency, yes, recognizing that and replacing it. But most people don't have those deficiencies, and they can still have mental symptoms or mental health problems. I believe what the diet is doing is it forces a transition in brain and body metabolism, essentially. And that transition is actually mediated through mitochondria. So the ketogenic diet forces your liver to start producing ketone bodies. So it forces your liver to break down fat. So you're losing fat from your fat stores, but that fat is being shuttled to the liver. And then the liver takes that fat and breaks it down. And I mean, I shouldn't say all of the fat is being shuttled to the liver. Some of the fat is going to muscles and other tissues and just being used directly. But a fair amount of the fat is actually being shuttled to the liver. And then that fat is being converted into ketone bodies. Some of it is being converted into glucose so that you maintain normal glucose levels through this. Those ketone bodies are then going up to the brain and fueling brain cells. But those ketone bodies are actually doing so much more. They're changing mitochondrial function, they're changing epigenetics, they're changing neurotransmitters and inflammation and all sorts of things. But at the end of the day, I'm convinced that it's really the metabolic changes and the mitochondrial changes that are so important and that are so instrumental in these dramatic improvements in things like stopping seizures or stopping hallucinations and delusions.
What about fasting? There's been a lot of talk, especially recently, about fasting and the impact that can have on our mental health. Do you think fasting is a positive for our mental health?
So it depends on the person.
Okay.
And so the ketogenic diet actually mimics the fasting state. That's why it was produced.
Oh, right.
The ketogenic diet was actually developed by a physician recognizing that fasting can have really powerful brain effects, including stopping seizures. If you're out on an island and your friends start seizing uncontrollably, the best thing to do is to fast them. Even if the seizures stop intermittently, you would think, oh, let's feed you to, keep up your sustenance and, take care of you. The best thing to do for your friend, if they are seizing repetitively over days or months, the best thing to do is to fast your friend and to tell them, let's have you go without food for a few days. And that can stop the seizures.
Wow.
The challenge with fasting is that you could starve to death if you do it long enough. And that's not a very good treatment for your friend on the island. And this physician who developed the ketogenic diet recognized that. And so that's why he developed the ketogenic diet, was really looking to see, can we mimic the fasting state with a diet and get these longer term benefits? So back to your question, can fasting play a role? 100%. Yes, fasting can play a role. And fasting is doing pretty much the same thing that the ketogenic diet is doing. It's changing mitochondrial biology. It's improving mitochondrial function, changing neurotransmitters, changing the gut microbiome, improving insulin signaling and insulin resistance. It's doing all sorts of beneficial things. There are a couple of caveats with fasting, though. One is that people who are underweight should not fast. So that includes people with eating disorders who are emaciated or underweight, but it also includes people who have had severe depression and lost weight as a result of their severe depression, or people with cancer who have lost a significant amount of weight. Fasting is not good for them. Fasting mimicking diets like ketogenic diets may in fact be very powerful for those people, it needs to be done in a safe, supervised medical way.
Sugar. What impact does that have on the mitochondria? If I've got a super high sugar diet, is that impacting my mitochondria in some way and therefore my metabolism?
It is. So low intake of sugar in people who are otherwise healthy is perfectly fine and acceptable. So, lots of people can consume treats every now and then, or desserts a few times a week, or special holiday, they can maybe even binge on sugar over the holidays, and they don't have any problems as a result of it. And that is fine if that's the way it's working out. Again, only 7% of the population is metabolically healthy. So the majority of people, that's not the way it's working out. So high levels of sugar over time, we know can impair mitochondrial function. So there's this term called oxidative stress. And oxidative stress is primarily, it's directly related to mitochondria, because mitochondria are producing the energy, and then that energy production results in oxidative stress. And oxidative stress, we've known for decades, is bad for cells, and it is highly correlated with all of the metabolic disorders and all of the mental disorders. High levels of oxidative stress in different cells, in different people with different diagnoses, high levels of oxidative stress are a unifying theme. But that is a reflection of mitochondrial dysfunction. So we know that if you eat a lot of sugar over time, it can dysregulate glucose levels, and then those high glucose levels can cause mitochondrial dysfunction, and you can end up kind of on the downward spiral.
What about caffeine and these stimulants? There's like pre-workout stimulants, and before you do a workout, you have a big dose of this pre-workout, and it kind of makes you go, Do you have a view on caffeine and these sort of energy stimulants?
I do. So caffeine gets complicated because we have to talk about whether it's in tea or coffee or not, because tea and coffee are different stories, and they have other compounds that almost certainly are beneficial to human health. And whether it's the caffeine itself or not is still kind of a question, an open question. Caffeine stimulates metabolism in cells. We know that. So it blocks the adenosine receptor. And the adenosine receptor, the function of the adenosine receptor and adenosine on it is to slow a cell down. It's basically a feedback loop that slows cells down. It inhibits their function. So when we block adenosine, we basically stimulate the system, and we stimulate our brains. And if you have low metabolic brain function, that can actually be really good. If you are feeling tired and sluggish, it can make you feel energized and clear thinking. The challenge is that you can overdo it. So when you stimulate it too fast, that in and of itself can end up causing oxidative stress or mitochondrial dysfunction. Maybe the easiest way to think about it is this. If you think about a car, you have an accelerator and a brake. If you're going to maximize the car's function, there's a right balance for all of that. Mm-hmm. You don't want to floor the accelerator, and you don't want to underdo the accelerator. Likewise, you want to determine, you don't want to be pushing on the accelerator and the brake at the same time. So when we think about metabolism and mitochondria, when we think about caffeine or even glucose, caffeine and glucose are stimulating the system. They are through different mechanisms, but they are both stimulating energy production. But when you overdo it, it would be like flooring the accelerator. and then possibly putting on the brake at the same time because you don't want to be going that fast because you're going to crash. So either you're going to floor the accelerator, crash and burn, or you're going to floor the accelerator and slam on the brake at the same time. You're not serving your car well by doing that, by flooring the accelerator and pushing on the brake. And when we use substances like caffeine or alcohol or marijuana, which are all working at the level of metabolism and mitochondria, when we use those substances, in essence, we're using accelerators or brakes for cells. And we can overshoot or undershoot. So it's not that I'm against the use of those things. If you use reasonable, small to moderate amounts of those on a regular basis, I'm all for it. So I drink coffee every day, every morning
I was just
to
hide
disclose my bias.
If you love the Diary of a CEO brand and you watch this channel, please do me a huge favor. Become part of the 15% of the viewers on this channel that have hit the subscribe button. It helps us tremendously, and the bigger the channel gets, the bigger the guests.